right. So we're talking about today clinical research programs, right?
Yeah, September is Clinical Research Month for me, just because new studies are starting and people want to get involved in it. You want to do it before the holidays hit and the big crunch is on for holiday stuff. So I think people need to understand why they would be involved in the clinical research program. Sure, you get free visits, office visits, and supplies. You get free attention. You have your own coordinator to sort of baby you through the study. So you get a lot of attention. But if you think about diabetes, which is a chronic disease, you really need to concentrate on it every day. So the more times you go to the doctor, the more times you think about diabetes, the more times you're required to check your blood sugar. All of these things make your diabetes better. And so if you're in a research program, they make you do stuff.
Right.
They make you check your blood sugar. Then you have more interactions with our staff so that they're always reminding you about your diabetes, and you're trying to do good. You're trying to do good for the study. Even if you're on the placebo, people do well in studies. That's why they have placebos, because especially diabetes studies, when you can control it pretty much by what you do, they would need a placebo group so that you can see how good the placebo does. Because a lot of times people go on, they start thinking about their diabetes, they go on a diet, they exercise more, they do a lot of things they're supposed to do all along, but when they're in the study, they're sort of got a spotlight on them, and they want to really...
And they got somebody else looking at the numbers, right? I mean, there's a little bit of that,
right?
Too.
Yeah, looking over their shoulder, because, you can, ignorance is bliss as far as diabetes, I guess, because you can just not check your blood sugar and you're fine. But when you start checking it, you realize, ooh, I ate that spaghetti last night, and then my sugar was 300 the next morning, something's wrong. Or if you go in and you see a bunch of blood sugars and they're all good except for one or two, then you go, well, what are those? And then we try to analyze what the blood sugars are, why they're high, how to keep them down. So during a study, it's almost like you're under the microscope as far as your diabetes.
Well, actually, I had somebody over the weekend and asked me a question about this. Hear us talk about it, and they were saying, well, I don't want to be the one that has the placebo. I mean, I want to make sure that I'm taken care of. But usually, and I mentioned that usually you're looking for people who are already taking certain medicines, right?
Yes. They don't really do studies with people taking no medicine for diabetes anymore, since everybody should be on metformin. It used to be the American Diabetes Association recommended, diet first, but realizing that by the time you get diabetes, half your ability to make insulin is gone forever. They also thought, well, we better change that. So it's not diet alone, it's diet and metformin. So all the studies now pretty much want you on metformin, and we have a couple of those. But there are other medications for diabetes now, a lot of other ones. So different studies require different medications. They also require you to be a little bit out of control. Most of them want an A1C of 7 or 7.5 because they don't want you to be perfect. If you were perfect, they don't want you in their study because then your sugar won't go down much. I mean, they won't see any kind of effectiveness of their medicine. So they want it to be 7.5. Some of them want your A1C to be 8 so they can see a bigger drop in your blood sugar. But you always have to take the placebo in account when you're doing the study, because the placebo A1C may go down, 0.5% or a whole percent, depending on how well you work on your diabetes during the study. So they have to subtract that from the effect of the drug.
Now, somebody also, this same person was asking, do you have to have insurance to be in a study?
No, the sponsor of the study, which is a pharmaceutical company, pays all the expenses for the study. So they pay for your office visit. They pay for the study medication. You still have to take your own medicine, still have to pay for your own medicine. But as far as the study medicine, that's included. All the lab work's included. The sponsor pays for all that. So really, you don't have any out-of-pocket expenses, and then you get paid a small amount each time you come for the study for travel expenses.
So again, it's a win-win for everybody.
Yeah, I think it really helps. I think most people that do one study are sort of hooked on it, but then sometimes they get too well controlled and they don't qualify. For the next study, they say, "Well, I can take care of that. I'll work on qualifying for the next study, so
really
they can see
them."
Like, no, just wait.
That's right.
It might creep back up later, and if not, it's fine. It's good.
Yeah, that's good. I mean, that's actually a good thing for the person. So
and then they always say, well, what if this drug really works and it's not on the market? I said, well, there might be some that are, We'll just have to see after the study if you want to do it.
Well, what kind of patients are you looking for now?
Right now, we're looking for metformin only, and with an A1C of 7.5 or 8.
Mm-hmm.
They're not controlling metformin. We're looking for those. We're looking for people with heart disease, people that there's a couple long-term studies. There's a weight loss study for people with heart disease, and then there's another type of medication that pulls sugar out of your body for heart disease. So those are long-term. Those are like 5-year studies. So they get the medication for free for 5 years. And so those are the main ones we're looking for now. And then we have 2 type 1 studies. So the first ones we're talking about were for type 2. Type 1 are the 2 studies involving that same type of drug that pulls sugar out of your body. So that's a big deal, trying to get that approved for type 1.
If there's somebody who has never been diagnosed with diabetes, but they have all the signs, they have family history, and they know they should have been checking all along, can they come and they get a checkup? Or?
Well, we can do that, but usually it's a primary care doctor, and if they check the A1C, then they'll know if they really have diabetes or not. Because if the A1C is normal, you don't have diabetes yet, you might have, or well, A1C usually goes with pre-diabetes, but you could have insulin resistance, or you could have swings in your blood sugar before you actually get a high A1C. So you can have blood sugars going up after meals, and get sleepy when you eat, and then drop later and get shaky. So those type of people are at risk for diabetes, but they may have a normal A1C.
Okay, coming up in a moment, we want to tell you about the diabetes school that's coming up and how you can take part in that. We have a caller with a question for us this morning, and Armando in Jacksonville. Good morning, Armando. How are you?
Good morning, Ben, Dr. Lucas. I don't really have a question about any of your studies or anything, but I have a question about medication other than metformin. I'm 56 years old, type 2 diabetic. I've been diagnosed about 3 years now. My last A1C was 6.7. My doctor wants me to stay strictly on metformin, and because that 6.7, I guess, shows it's under control, kind of. But my daily numbers, I'm not really happy with them. And you mentioned Farxiga and a bunch of other medications. Some of them have a side effect of weight gain, and I'm already overweight, which is what a lot of diabetics probably deal with. But what are the actual risks of medications like Farxiga and things like that? Are they as high as my doctor's think?
No, diabetes is worse than any medication for diabetes. The risk of having high sugars is worse. So I wouldn't consider any problem with medicine. They go through years of testing before the FDA approves them, and the FDA, withholds their approval for a long time until they make sure about them. So I think they're pretty safe to do. It's worse to keep your blood sugar high. So if your blood sugar goes up after meals, there's plenty of choices that help you lose weight. There's the GLP-1s, which are like Victoza, and then there's the ones like Farxiga.
All right, Armando, thanks for joining us, but check with your doctor on those things as well, too. And Diabetes School, October 10th at the History Place. Go online at beachdoctor.com and sign up now. We'll see you next week.
Okay, thanks.